Welcome to This Week in Rheumatology. This week we're covering 10 notable papers spanning vasculitis management, spondyloarthritis therapeutics, rare autoimmune conditions, and early rheumatoid arthritis detection. Let's dive in. Beginning with vasculitis and systemic connective tissue disease, the European Alliance of Associations for Rheumatology has updated its comprehensive management recommendations for polymyalgia rheumatica, giant cell arteritis, and Takayasu arteritis in Annals of the Rheumatic Diseases. The task force outlines that all patients with suspected large vessel vasculitis should be referred for specialist assessment within 24 hours, and glucocorticoids should be commenced immediately in strong clinical suspicion of giant cell arteritis without waiting for confirmatory tests. For induction, prednisone equivalent doses of 15 to 25 milligrams daily are advised for polymyalgia rheumatica and 40 to 60 milligrams daily for giant cell arteritis or Takayasu arteritis. Notably, the guidance endorses adjunctive interleukin-6 receptor inhibitors for polymyalgia rheumatica and giant cell arteritis, upadacitinib for giant cell arteritis, and routine glucocorticoid-sparing agents for all Takayasu arteritis patients. Staying in the realm of rare systemic conditions, a Phase 2 trial, an oral Bruton's tyrosine kinase inhibitor in immunoglobulin G4-related disease across rituximab-experienced and naive cohorts. Following a brief glucocorticoid taper, 70.4% of participants were successfully flare-free and off glucocorticoids or immunosuppressants at the end of treatment, with a mean responder index reduction of 10.7 points in those completing 52 weeks, though diarrhea occurred in 40.7% of patients. Meanwhile, single-cell RNA sequencing of peripheral blood mononuclear cells in Behçet's disease, also reported in Annals of the Rheumatic Diseases, revealed that all three monocyte subsets are markedly expanded and exhibit dominant interferon gamma activation in active disease, whereas remission is characterized by type 1 interferon-regulated genes and serine protease inhibitor pathways, highlighting phenotype-specific immune signatures between vascular and ocular disease. Turning to psoriatic disease and spondyloarthritis, the Phase 3 POETY-KPSA2 trial in arthritis and rheumatology assessed oral deucravacitinib versus placebo and apremilast in psoriatic arthritis patients who were biologic naive or experienced. Deucravacitinib achieved a significantly higher American College of Rheumatology 20% response rate at week 16 compared to placebo at 54.2% versus 39.4%, with responses maintained through week 52 alongside consistent improvements in physical function and quality of life without new safety signals. To help distinguish cutaneous psoriasis from psoriatic arthritis, researchers publishing in Rheumatology investigated neutrophil elastase and its inhibitor elafin, discovering that patients with psoriatic arthritis exhibit a reduced regulatory capacity and decreased elasan expression in both skin and blood compared to plaque psoriasis patients alone. In vocational rehabilitation, a pragmatic multi-center trial across 18 United Kingdom National Health Service trusts evaluated the Workwell Job Retention Program for inflammatory arthritis patients experiencing work instability. While the intervention did not yield a statistically significant difference in the Work Limitations Questionnaire 25 compared to self-help advice at 12 months, it showed a relative reduction in absenteeism of 46% and higher 36-year employment retention at 93% versus 85%, though it was not considered cost-effective from a National Health Service perspective. Examining adult-onset Still's disease, a two-center cohort study in arthritis research and therapy compared first-line biologic immunomodulation against non-biologic therapies using overlap weighting and emulated target trials. Biologics were associated with a significantly higher likelihood of sustained event-free remission compared to non-biologic modulators, demonstrating clear long-term advantages over conventional synthetic disease-modifying anti-rheumatic drugs, calcineurin inhibitors, and Janus kinase inhibitors at 72 weeks. However, pulmonary involvement in adult-onset Still's disease remains a formidable challenge, as highlighted in a Chinese cohort study in Rheumatology showing that lung disease occurred in 23.4% of patients and independently predicted both macrophage activation syndrome with a hazard ratio of 2.62 and disease relapse with a hazard ratio of 2.66. In the evaluation of early rheumatoid arthritis pathogenesis, a longitudinal Karolinska risk-RA cohort study in Annals of the Rheumatic Diseases explored ultrasound-defined pre-synovitis in anti-citrullonated protein antibody-positive individuals with musculoskeletal symptoms but no clinical arthritis. Baseline ultrasound findings, most notably tendon sheath involvement, were associated with a threefold increased risk of developing clinical arthritis over a median follow-up of 13 months, with hazard ratios reaching 4.2 when combined with immunoglobulin M rheumatoid factor positivity, mapping a distinct pre-arthritis transition phase. Finally, a systematic review in rheumatology evaluated dietary interventions and muscle diseases, finding that while evidence remains limited, mechanistically targeted approaches such as creatine, combined with exercise in inflammatory myopathies, carbohydrate-rich diets in McArdle disease, and acineuramic acid in GNE myopathy, demonstrated meaningful functional improvements. If you only have time for one paper this week, make it the updated EULAR recommendations for polymyalgia rheumatica and large vessel vasculitis. It provides immediate, actionable guidance for rapid referral timelines, upfront glucocorticoid dosing, and the integration of targeted JAK and IL-6 inhibitors into everyday clinical practice. Here are the key takeaways from this week in rheumatology. Updated EULAR guidelines streamline management for polymyalgia rheumatica and large vessel vasculitis, emphasizing rapid 24-hour referral for suspected giant cell arteritis and incorporating targeted biologic and JAK inhibitor therapies. Deucravacitinib demonstrated sustained efficacy and a favorable safety profile through 52 weeks in active psoriatic arthritis. In anti-citrullonated protein antibody-positive individuals, ultrasound-detected tendon sheath involvement substantially increases the risk of progression to clinical rheumatoid arthritis. First-line biologic therapy in adult onset, Still's disease yields superior sustained event-free remission rates compared to non-biologic conventional agents. Rilzabrutinib showed promise as an alternative B-cell targeted therapy in immunoglobulin G4-related disease, successfully allowing glucocorticoid tapering in the majority of patients. That's your roundup for this week in rheumatology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.